Hi everyone, welcome to Medicine YouTube channel. In this video, I am going to see about an important topic in general surgery, which is ulcer. Ulcer is a type of wound which is a discontinuity of the epithelial surface which is due to the cell death or molecular death. It is a discontinuity of an cell's epithelial surface which is due to cell death. The ulcer can be classified into two types, which is by pathologically as well as clinically. Pathologically, there is specific ulcer, non-specific ulcer and malignant ulcer. Clinically, spreading ulcer, healing ulcer, non-healing ulcer as well as callus ulcer. These are the classification of the ulcer. Before entering to these classification, before I explain these classification, we should know about the parts of the ulcer. Parts of the ulcer. This is the margin. This is a border present in between the epithelium as well as the outer epithelium and the ulcer. This margin separates the ulcer from the outer epithelium. And this is the edge which connects the margin as well as the floor. The floor is the exposed surface. When we see the ulcer from the top, the floor is exposed and the base is below the floor. These are the parts of the ulcer. The margin first. The margin, the border present in between the normal epithelium and the ulcer is known as margin. Floor. It is the exposed surface of the ulcer. When we see from the top, the floor is visible. So it is an exposed surface of the ulcer. Edge. The edge is present between the floor and the margin. The edge is present between the floor as well as the margin. The base is present below the floor. Here the base, this is present below the floor. So edge is the one which connects the floor of the ulcer to the margin. As I have said already, according to the edge, we can see the types of the ulcer. There are different types of edges. Sloping edge. It is seen in healing ulcer. Its inner part has red because of healthy granulation tissue. There is healthy granulation tissue present in the inner part of the sloping edge ulcer. The sloping edge, it is also known as healing ulcer because the wound healing takes place from the inner part. So the inner part is too small so that it heals fast. So it is known as healing ulcer. It's undermined ulcer, which is seen in tuberculous ulcer. The inner part is too long and the outer part is small. The punched edge ulcer, it is also known as square cut ulcer. It's seen in syphilitic ulcer, trophic ulcer as well as pressure sores. Everted ulcer, it is rolled out edge, seen in carcinomatous ulcer, which is seen in squamous cell carcinoma. Raised beaded angle is seen in rodent ulcer. These are the different types of edges. Now you will see the classification. Now you will see about clinically the spreading ulcer. Here the edges are inflamed and it is edematous. The edges which connects the floor as well as margin, they are inflamed and edematous and it does not heal and spreads. So it is known as spreading ulcer. Healing ulcer. Edges are sloping with healthy pink red granulation tissue and this ulcer heals fastly. As I have said already, when there is sloping edge present, it heals fastly than the normal edge because the healing takes place at the center first as well as at the top next. So the healing ulcers heals very fastly. Non-healing ulcer. There is chronic ulcer with unhealthy granulation tissue and slough in the floor. There is slough in the floor and there is unhealthy granulation tissue. So this ulcer does not heal fastly. Now callus ulcer. The floor contains pale unhealthy granulation tissue with indurate edge at the base. The ulcer has no tendency to heal. This ulcer, callus ulcer, is pale and unhealthy granulation tissue are present. So there is no tendency to heal this ulcer. Pathologically, it is divided into 4 types. 3 types which is specific ulcer caused by specific cause. Example, tuberculous ulcer, syphilitic ulcer and actinomycosis. These are the specific ulcer which is caused by the specific cause. Now we will see the non-specific ulcer. There is no specific cause. For example, traumatic, trophic ulcer, venous ulcer, infective ulcer and arterial ulcer. These are the examples of the non-specific ulcer. Malignant ulcer formed due to the malignancy. Carcinomatous ulcer, rodent ulcer and melanotic ulcer. These are the malignant ulcer which is caused due to malignancy. Now we will see about the treatment of these ulcers. The treatment is divided into 2 types, which is conservative treatment as well as surgical treatment. The conservative treatment are regular dressing. The dressing should be done regularly. Infection treatment. First, we should provide the treatment to the infection which is caused due to the cause of the ulcer. First, we should reduce the etiology. We should know the cause and we should cure that, and then we should cure this ulcer. Steroid therapy is given. Supportive treatment. When the patient is hypertension or diabetic, first we should give that treatment first, and the supportive treatment should be given. Compression bandage. The compression bandage increases the blood flow so that the area in the near the ulcer, when there is increased blood flow, it heals fastly. And topical antimicrobial agent. Now surgical treatment, slovectomy. The granulation tissue, the unwanted things which is present in the slough. The slough is removed in the ulcer. It is known as slovectomy. Surgical debridement, flap therapy, flap surgery, skin graft. When there is the ulcer spreads fastly and it does not heal, now there is a chance of skin grafting and amputation, cutting of the particular part. These are the treatment of the ulcer. If you like this video, please do like, share and comment my YouTube channel. If you have any doubt in it, please do comment it. If you want any other topic, please do suggest in the comment box. Thank you. Please do subscribe.